Hello, Professor. Hello.
Hi there. How are you, Jennifer?
I'm fine. How are you?
Not bad. So what you might want to do is, if you have the Ammerman, is to go to page 160 on the skull, or just open up in a textbook the skull, because that's what we're going to start talking about when we get everybody here. Okay?
No problem. I missed last week because I had to do something during the time of class, so I wasn't able to be for class for last week.
Okay.
But I got.
Were you able to go ahead and take the quiz and go over some of the material?
Yeah, I did. I got the quiz done, and I did pretty good. I think I got like a C or something, or a B. I'm not sure. I think I missed about 3 questions.
Hi, Corey. So I know we're early, but I want to be on just so that we can get everybody here. Okay. So, and Corey, what you want to do is get your Ammerman open so that you can look at the skull. Okay. Or find a picture with a frontal view of the skull, because that's one of the things that we want to talk about. All right, Jennifer, so let's review last week.
Okay.
Okay, so
Yeah.
last week we talked about 3 different types of cartilage, and
Yeah.
one of them is called hyaline, and I happened to use this last week. This is the sternum. We'll talk about it as well. This is hyaline cartilage, and basically it's found in the ribs, and it's found at the ends of bone. So I have some notes that I could read to you that might make some sense. And okay. I found this when I was on the school this week. So it was talking a little bit about basically long bones are called long bones because they're longer than they're wider. Okay, so the majority of all the bones in the body are long bones. They are slightly curved for strength. And they're primarily, what you're going to see is what's called the compact bone or hard bone, okay? The spongy bone is typically inside, underneath the compact bone. And examples of the long bones are the femur, your tibia or fibula in your leg, even your phalanges, because even though they're not as long as, let's say, a femur, but they're longer than they are wider, so they're considered long bones, okay? The radius and ulna, which are in your, basically in your forearm, they're long bones. Short bones are found in carpals, in the wrist, and in the tarsals. And they're somewhat cube-shaped. They're what we call short bones. And what makes them, most of them are primarily, like in our wrist, they're primarily spongy bone. Maybe that's why when we fall on an outstretched hand, we break or fracture the wrist. So that's the short bone. They're only in 2 locations, wrist and ankle. Then we have what are called flat bones. Flat bones are of the skull, and they're called flat because basically, if you look at them in end, see they're kind of flat in structure. So in other words, you know, even though they're somewhat curved. So flat bones are the cranium. This is our sternum, and it's also an example of...
And a scapula, right?
Yes, scapula, ribs. Let me go ahead and see if I can let some people in.
No problem.
And so we'll admit everybody. Okay, so so those are flat bones. Irregular bones are, some examples are the vertebra. So when we look at these tonight, these are all considered irregular. We're just talking a little bit about what we went over last week is what we're doing right now. And so there are other bones. One's called a sesamoid. That's the patella. That's an example that we talked about last week as well. But what we talked about, we were describing where you're going to find the different type of cartilages. So elastin cartilage has to be flexible. So it'll be in your epiglottis and it's in your ear. And then we talked about fibroid or fibrocartilage. Fibrocartilage is in the meniscus of the knee, and it's actually in the vertebra. So when we talk about the spine tonight, this is fibrocartilage. And it's there because the fibers that are comprising this cartilage are collagen for strength.
Okay.
Okay. So that gives you a little bit of information. So today what we're going to do in about 3 minutes is talk about the axial skeleton. And our axial skeleton is skull and spine, basically going down to the sacrum and the coccyx. Next week, we'll do what's called appendicular. And appendicular is the appendages, basically. So I'm just trying to get everybody here into the class. Any questions on what we're doing so far? Somebody asked me if we're going to have a midterm. And I said that I guess the midterm, if you want to consider it, is what is upcoming in about 3 to 4 weeks. And so that'll be after we talk about axial and appendicular, and then we have 2 weeks on muscles. So what we want to do is make sure that we get down, for instance, you don't want to get 2 weeks behind. You want to each week spend time like on axial this week, so you get it down. So next week, when we start talking about the appendicular, you'll be able to just concentrate on that, because when you get behind, it's a little harder, okay? So we're not yet ready to get started as far as for tonight's class, but we will in a moment. There has to be some questions about the course. Are there any questions that I can maybe answer for anyone? So if we have anyone, go ahead and put your video on so I can see your smiling face, or else I don't see smiling faces, but a black box and a name. So if I have to show my face, you do too. Okay? So, all right. We're getting there. Does anyone know, last week we talked about calcitonin and parathyroid hormone. Does anyone remember what each one does? And how do you remember? That's a question for anybody. Jennifer, you want to help me? Seth, you want to help me? Remember
I believe
Go ahead.
with the parathyroid hormone, it puts calcium in the blood. Is that correct? Or
Well, yes, it does. So that's one way of looking at it. So PTH, parathyroid hormone, is when calcium levels are low, and it uses osteoclasts and liquefies bone, and it raises the calcium levels in the blood. How do I remember? Remember, I kind of got crazy and said calcitonin. Remember, calcitonin tells me what that hormone does. So when do I need calcitonin? Anybody? Anyone remember? Calcitonin is when calcium levels are high, and therefore we're going to take calcium out of the blood and stimulate the osteoblast or osteocyte, and we're going to make bone. So in other words, when I take calcium out of the blood and I store it in the bone, the levels in the blood actually go lower, and they would go back to being more normal. Okay. All right, so we're 7 o'clock. So let's go ahead and take a look at tonight's lab. Tonight's lab is axial skeleton. And so where am I going to be using pictures? Well, you may want to use the Ammerman, and there'll be a picture of the skull. So you may want to, at this point, find from any of your references a picture of the skull, because we want to talk about the terms. You might want to have your assignment as well. If not, don't worry about it, because I'll be going over some of these names for you. So in other words, I have, and this is just an atlas. So this is one way to actually learn. This material is also in your textbook, but you can look at the various, like this is a frontal view of the skull. So that's probably a good place to start. So I brought a skull with me. I have one right here. So we borrowed it from the school. There are a number of bones in the skull that we need to know. So typically we're going to start with the one in the front. And I can't recall the name of the one in the front. Somebody help me out. Seth, what's the one in the front called? Help me.
I do not remember right now.
Okay, well, anybody? Jennifer, how about Brianna? What's the one in the front called?
Occipital?
Well, that's in the back. What's the one in the front?
Frontal bone.
Frontal bone is in the front, so it's really hard. Okay, so frontal is in the front. On the top is parietal, two parietal bones. In the back is the occipital. And on the side is the temporal bone, right in through here. So we've got frontal, parietal, occipital. On the side is our temporal bone. And if I open it inside, there's two other bones that we're gonna, so I've opened up, this is called the calvarium. It's the cap, it's the top of the skull. And when I take it off, we can actually look inside. Now to get yourself orientated, if the back of the skull is the occipital, the occiput still continues down. And when you look inside, this posterior third is still occipital. In the middle third, there's a bone that looks like a bat wing. So if let me do it this way. So in other words, what we're doing is the big hole in here is the foramen magnum, and then the bat wing is the sphenoid, and in the middle is the sella turcica. But we're just naming bones now. So this is still occiput. This one here is the bat wing called sphenoid, and then in the front, let's go back to the front. In the front, anything above the orbits of your eye is still frontal bone. So when I take this off and I look in face inside, we're still going to have frontal bone on either side, but there's one more bone we want to talk about, and it's right midline. It's called ethmoid. So when we look at the different bones, let's go over what they are. Frontal in the front, parietal, top, occipital in the back. Where did David kill Goliath? Where did he hit him with a stone? Which bone?
The temple.
Temporal bone on the side. So this is the temporal bone on the side. There's one on one side, there's one on the other. Okay. And then we said that there is a sphenoid or bat wing. And in order for you, if you're looking at your, let's say, one of the books, there's a nice picture in one of the books, and it shows the middle third. That's the bat wing. It looks like a bat. It's got big wide wings, goes to a little narrow point, and that's the sella turcica, which means Turkish saddle, and the pituitary sits in there. And then if we're looking at this colored picture, the area that is where it's blue is frontal bone, but then right in the center, I believe it's gold. That's your ethmoid bone. So these are the various bones, and we're supposed to go and know features. So the features are different points or areas of interest in these different bones. So for instance, let's go back and talk about the occiput. The occiput is the occipital bone, and it's here in the back. And there's two things we need to know about this, two features. One, foramen magnum, and you need to know what it does. So we're going to remember that we're going to use the term or the letter P for passageway. So your spinal cord goes through this area right in here, and adjacent to this opening are two rounded areas, and these are rounded areas are called condyles. So we're going to name this as the occipital condyle because they're rounded and they're in the occiput. They're important to know because I will take my atlas, which is this bone right here, C1 or atlas, and it will fit on these little rounded areas. And I have a cup actually on, I'm letting more people in. We have a little cup that the condyles will sit in. So basically it'll fit just like this. It'll move right in here. And how do you know that there's movement there? Well, what I want everybody to do is humor me. Jennifer, you too. Take your fingers, put it at the bottom of your occiput. So I want to see everybody's arms up. And I want you to tuck or flex your head forward and then move it backward. And when you do that, do you feel movement there? So when you're doing this movement here, and what am I doing when I nod like this? What am I saying? Anybody married? Nobody's married? You're saying yes, yes, dear. So when you're doing this, you're nodding, and that movement is occiput on C1, okay? All right, so, so we were talking about the occiput. Features are areas that you need to know. Foramen magnum, passageway. This is an articulation where the bone is going to meet another bone. Is everybody with me? Okay. So let me make sure we let everybody in. I think we've got 14 here thus far. So that's an articulation, or A. The next bone that they want us to know some features are on the temporal bone. And on the temporal bone, the ones that I want you to know is called the mastoid process. So there's an area that proceeds away from the skull in the temporal region. And then there's also a hole as well. The hole is where you actually are able to funnel sound into your ear and actually into the eardrum. This is the external auditory meatus. It's an opening. So that's your ear canal. And then this area behind it is called the mastoid process. And we're going to have a muscle attached there. And the muscle will go from the sternum and clavicle up to the mastoid. And this muscle pulls on it. And that's why you have this bump. Let's look on the other side. Does anybody see a bump on the other temporal bone? See it right here? So this is the mastoid process. A process proceeds away from the rest of the bone. For instance, I have a, let's go back to a cervical. I have a cervical vertebra. This is a typical cervical vertebra from C3 through C7, and it will have a body. It'll have a transverse process that proceeds away. Notice I'm saying process. This is transverse on either side, and it has a spinous process to the back. So when you hear the term process, it's like a bit of bone that is extending away from the other bone. So I have my cervical spine. This is my spinous process that's in the posterior part. So all these little things that I'm touching right now, and if you put your hand, go ahead and do that. Take your finger and put it on the back of your neck. All the little bumps in the midline, those are the spinous process. And if I were to take my fingers on the side of my neck and press in and feel the bone, that's transverse process. We'll be going over these more than once. So when I look at this bone that happens to be a lumbar, it's a lot larger. What we're going to find is a spinous process going posteriorly and a transverse process that goes lateral on either side. And then I have a vertebral body, which is the main area. And then we're going to have a vertebral, you're learning it differently than I did, foramen. So this area, I think of it as the spinal canal, and I think they want you to think of it as the vertebral foramen, but it's an opening where nerves go through and the spinal cord goes through there. All right. So in the temporal, there were two areas we needed to know: mastoid process here and external auditory meatus. In the sphenoid, remember I have to get inside, look in the middle third, there's where the wings come together, there's a little narrow area. There's a depression in here, and this depression is the sella turcica. And so in riding horses, you'll notice that the Western saddle has a horn in the front and a wider, flatter rear part to the saddle. A turkey saddle has a high front and a high back, and what you would do is be to sit inside of this, but that's where the pituitary gland will rest. Ethmoid bone. Ethmoid bone is surrounded by the frontal bone. Frontal bone is on either side, and here's the front of your face. There's a raised little area called the crista galli, G-A-L-L-I. It's the attachment for the dura, or the outer covering of the brain. So if you don't want to dislodge your brain, you better make sure that the crista galli is attaching itself to the outer covering of the brain, and that's what it's known for. So it looks like a little bump right in the midline. On either side are little tiny holes, and those little tiny holes are called, I have in the front of my face, my nose. And so it's there for a reason. It has to, I have to have receptors for smell, but I got to get that sensation into my brain. It will go through the olfactory foramina, which are little tiny holes on either side of the crista galli. Okay? So the olfactory foramina is a P for passageway. Nerves go through there. First cranial nerve. You don't need to know that it's the first cranial nerve. You just need to know it's a passageway. All right. Everybody with me thus far? We've only gone through what, 12 or 15 terms. Let's go over the facial bones. So basically when we start looking at it, at your nose, up in the front, we have nasal, N-A-S-A-L, and we'll have one on either side. And then just lateral is called the lacrimal bone. And you know you're at the lacrimal bone, there's an actually little opening where you drain your tears. So we basically have, we produce our tears outside of the lateral aspect up here above the orbit of the eye, and every time you blink, water will flow across your eye, and it'll actually drain through the lacrimal bone. And so if you cry a lot, you can actually cry and you get water in your nose, obviously, or if it's windy. Okay, so we have nasal, lacrimal. This is called the zygomaticus, and it's the zygomatic bone. And so put your hand on your cheek, go ahead and feel the bump in that area. This is your cheekbone. That's your zygomatic. Now there's a piece of bone that proceeds away from the zygomatic. What are we going to call that part of bone that actually proceeds away? Let's call it zygomatic process. So we're going to keep using these same terms over and over again. Okay? So the zygomatic is here. And the reason you're learning this bone is that there's a muscle called the zygomaticus. And that is used in order to smile. So when you're smiling because you're learning all this fun stuff, Corey, and you raise your corner of your lips upward, there's muscle attaching the zygomaticus to around your mouth, and it allows you to smile. So that's why we're learning this bone zygomatic. All right, the bone above, let's say above the mandible. So this is the mandible, that's the bottom. The bone above it, or just below the orbit, is the maxilla. And the maxilla, the only one they want you to know there is infraorbital foramen. So what am I saying? Infraorbital. The orbit is the eye. This is below the eye. It's called infraorbital. What is the one above the eye called? Supraorbital, but you don't need to remember that. So there's one above the eye. There's a little opening here. It's a passageway, and that's called infraorbital foramen. It's a passageway for nerves. Okay, let's take a break, and let's take your two fingers. Everybody humor me. Everybody just look at me here. Put your hand or your fingers on above your eye, the orbit, and find that little depression. And if you rub on it when you have a sinus, let's say a sinus headache, you can relieve some of that headache feeling because your sinuses are going to be right in this area. There's 4 sinuses. One of them is in the frontal bone. There's going to be on each side in the maxilla, there's sinuses here. Then you have just underneath this, remember in the middle of the frontal bone, there's the ethmoid, and behind the ethmoid is the sphenoid. So you have 4 pair of sinuses, and they're going to be right in this area. So when you get a sinus headache, if you feel like all this pressure around your eye, there's a reason for it because that's where the sinuses are. So we'll talk more about that in a moment. All right, what are the 3 features we need to know of the mandible? Well, the mental foramen is this little opening here, and this is where your dentist will go ahead and inject if he wants to numb part of your lower jaw. Okay, so that's the mental foramen. It's a passageway. And then I have 2 areas of the mandible. One is rounded. It's a condyle. Everything that's rounded are condyles. And so this is the condylar process of the mandible, and it goes into the temporal bone. And so it becomes the temporomandibular joint. So when you ever hear TMJ, each letter stands for something. Temporomandibular, okay, mandible joint. But this is the condyle. And so last night we did something. I want us to do that again. Take your finger, put it on the side of your jaw and open your mouth. Please do that, Seth. You feel it pop? There's a little cartilage in between these 2 bones, and when you open your mouth, it'll pop. And so that allows you to open your jaw. So that's your temporomandibular joint. But there's another feature I didn't mention. I'm going to pick on Corey because he looks bored. Corey, help me out. Clench your jaw, make your jaw real tight, and feel the muscle just down by the angle of the, this is the angle of the jaw. See the angle? Try and tighten that muscle. Make it real tight. I'm going to do it too. I'm going to look funny. And what do you feel? You feel like that little knot on either side? All right, open your mouth. And when that muscle tightens, it'll close. This is your chipmunk muscle. It's called the masseter. And so what do you think attaches to this coronoid process? Jamie, I'm going to give you one guess. What do you think is going to attach right there? This chipmunk muscle, the masseter. And so the reason you're learning this feature, this is the coronoid process, and it's a muscle attachment. Next week in my shoulder, I have a coracoid process, but this one is further north. Does everybody gather what I'm trying to say? This one is north, so it has an N, coronoid, and the masseter that's on either side that I can protrude, it attaches there, whereas down here, I have a coracoid, and another muscle will attach down below. Okay, so on the mandible, there's 3 features. Oh, by the way, Corey, thank you. Okay, what was the hole called up in here? What was this hole called? Let me think again. I'm trying to think. What was it called?
The mental foramen?
Yep, mental foramen. What was the condylar part where I had to round it in the back? What did we call that?
Condylar process?
Condylar process. And then this little area that looks like a triangle that's flat, it's the coronoid process of the mandible. Okay, and it's a muscle attachment. Okay, let me ask you some questions and see if we learned anything. The attachment site for the dura of the brain is the blank. What's the answer? Anybody recall? The attachment to the cristogala of the ethmoid bone, where the dura, your brain covering, attaches, what was that called? Go ahead. Catherine, do you recall? Anybody? Jennifer? Okay, remember, okay, so it's the crista galla. That's one of the things. What is the gland that sits in the sella turcica inside the sphenoid? Does anybody recall?
Pituitary gland. The pituitary.
Pituitary gland. And so it's an important gland it's inside the skull. Pituitary is in the middle. Third, it's in this sella turcica of the sphenoid, bat wing. Okay, I haven't mentioned this bone. Maybe you had it in lecture. Name the only bone in the body that does not articulate or touch any other bone. And it's below the mandible, and it looks like a horseshoe, and your tongue attaches to it. What was it called? Does anybody have it in your notes?
Is it hyoid bone?
Yeah, it is, Seth. Good. Hyoid bone. I thought that was you, right? Okay, it's the hyoid bone. So it wasn't Seth. Who was it that answered that for me?
Justin.
Hey, Justin, thank you. Okay, so I don't see everybody all at once. I only see like 12 of the 15 that are here. So the hyoid bone is a little tiny bone. And so you may get a picture of like the spine. And then, so what they do is this hyoid bone, they'll have it sticking out. So it'll look like there's like a little U shape out here. And it's a bone that your tongue muscles attach to that allow you to open and close your mouth. It's called the hyoid. So those are 3 questions that we had. All right, let's talk then about sinuses. Let's go over it again. So I've got my skull. I'm going to have sinuses in the frontal bone, right here in the front, in the maxillary, and then inside, I'm going to have them in the ethmoid. Let me go ahead so you can see it. When you can see it, what I can like if I go like so, this area right here is midline. This the ethmoid. There's the sinus there, and then in the sphenoid bone in this area, let me kind of turn it. There will be a sinus there. So I got a sinus deep. I got a sinus here on the ethmoid. I have one in the frontal, and then down in the maxilla on either side. So if you've had a sinus infection, you're going to feel all that pressure. And so what's the function of the sinuses? From your notes, I have this. Lightens the skull, makes the skull lighter, okay? And then it adds resonance to your voice. Resonance to your voice just allows your voice to kind of become more, I don't know how you want to describe it, more pronounced. So when your voice resonates, it's because of your sinuses, okay? And there's mucus lining inside the sinuses. And so they trap pathogens or bacteria, and that's where we get the infection when we have too much bacteria inside. Okay, all right, let's talk about sutures. Sutures are where the various bones of the skull come together. And so if I were to set this calvarium or top of the let's say of the skull out, you would need to be able to tell that this is the frontal bone, this is the occipital bone, this is the parietal bone, and this is how you tell. Coming across in the front is the frontal or coronal suture. And so it will be this way coming across. So this is a frontal or coronal cut. What gives me a left or a right on my skull is the sagittal suture that's midline between the 2 parietal bones. So this is coronal or frontal. This is sagittal. I get a left side and I get a right side. In the back, I have what's called the lambdoidal, and it is separating the parietal from the occipital. That's in the back. And then I have a flat suture on the side, and this flat suture on the side is called the squamosal. So squamosal is actually on the side, and it is going to separate the temporal from the parietal, is what we actually have. Okay, so those are the 4 sutures: coronal, sagittal, lambdoidal, squamosal. And then there's something called fontanelles. Fontanelles are the soft spot, and they're the area where when the baby is born, there has to be a way that the skull can kind of compress on itself so the baby can get out of the birth canal. So there's a soft spot in the front called the anterior or posterior fontanelle, and on the side. So the main one that we want to think about is the anterior fontanelle. And so there's actually fontanelles anterior lateral and posterior lateral. But what they do, they allow for the various bones to be able to kind of ride over each other. So when my two boys were born, they had a normal birth. They were cone-headed children. So they had little cone heads, and then that reshaped as you know, after after a little while, after they were born. And so the fontanelles allow the skull to change shape for the birthing process, and then they allow the skull to change the shape as the brain grows, okay? And so what we have are now, they're called sutures, and they look like sutures because they're irregular. And so these are the sutures that we have that form after the fontanelles actually close. Is everybody with me thus far? Okay, if everybody can turn your camera on, that would be good. Let's now talk about the vertebra. And so we're going to get back to C1 or Charles Atlas. Why do they call it Atlas? Because it holds up the skull. Think of this as the world. So Charles Atlas, there's a model where he's holding the globe up, or the world up. C1 is a circle. Now, I know it's a cervical, even if I didn't know if it was C1, because it has a hole here. This hole is for what's called the vertebral artery. On either side, in the transverse, is this artery that takes blood to the posterior part of your brain. It's called the vertebral. So any cervical vertebra, whether it's C1, I'm going to have this opening where the vertebral artery goes through. Whether it's C2, this is, I know this is 2 because this is the dens. I have an opening where the vertebral artery goes through. So the first two are different. The third one, from 3 through 7, they're going to look like this. But again, I have an opening in the transverse where the vertebral artery goes through. So if you're not sure if it's cervical or not, look for that opening. And the opening, again, is the vertebral artery. That's how you can tell the difference between this vertebra, which is a thoracic vertebra. There is no vertebral artery. There's no hole or opening there. Also, when you look at this vertebra, it has a body, it has a transverse process on either side, and a spinous process that goes or proceeds away. So someone said that this looks like a giraffe. So if you can see a giraffe there, good for you. They say that the lumbar spine that has a body, a transverse process, and a spinous process looks like a moose. That's what they say. Maybe it's true. All right, so what are we going to do with C1? C1 is a ring. C2 is a pivot point. This is called the dens, which means tooth. And it will fit underneath and rotate. It'll rotate in here underneath C1. So again, let me have everybody put your hands behind your back, up by the skull, and turn your head, let's say, to the right, and feel the movement when you rotate. So that's C2, and that's where rotation, the majority of rotation. So Keisha, somebody comes in and they're telling me they got a headache and they're all knotted on one side. I know that the C2 is not rotating fully the way it should. So a lot of times when C2 is a problem, people are going to have migraine headaches. So this is the second or axis, C2. It has, again, it has a body. It has the dens or tooth. It is taught that this little dens or tooth is actually the body of C1 because C1 doesn't have a body. It's just a ring. And so what goes through here again is your spinal cord. Cord has to go right through there. And so this model kind of gives you more of that same understanding. This is the occiput with a foramen magnum. Underneath it, if I can look in there, there's like a condyle. The yellow part is the spinal cord. This area of the vertebra where the spinal cord goes through, they call this the vertebral canal. I didn't learn it that way. I learned that basically that this is the spinal canal. They teach you this as vertebral canal, okay? So we'll put these two together like so, and that's how we get movement. And then we'll take the third one, which is C3 through 7. Oh, let me ask this question. How many vertebrae are in each section? What are the numbers in the cervical, thoracic, or lumbar? Does anybody know?
7 in the cervical.
Okay, 7 cervical. How many thoracic?
15.
12.
12.
And how many in the lumbar?
5.
Okay,
5.
this is how you remember. That's when you drink Dr. Pepper. That's what they say. Now remember this, it's very important. 7 in the morning, 12 noon, and 5 at night. So that's when you drink your Dr. Pepper. 7, 12, and 5. Silly enough, but it works. You'll remember 7, 12, and 5. Okay? And so that's how many are in those segments. Let's get back to C3 through C7. It has a body. It has a, what's this called, going out to the side? Transverse process. And what proceeds away from the spine? Spinous process. Okay, so, and this is cervical because it has the hole for the vertebral artery. All right, so when I'm looking at it, this is the vertebral foramen where the spinal cord goes through. Let's go to the thoracic. What makes the thoracic, when you look at the body, it almost looks like a what? Maybe it's kind of rounded a little bit, but it's shaped kind of like triangular. Do you see how it has this triangular shape? Everybody follow? The body looks triangular. And then it has this broad area of the transverse where the ribs go in. So in other words, the ribs are going to actually attach here and go around to the front and attach onto this area right in here. Okay. But if you look at it, the spinous process is proceeding down or back. And then this next one is a lumbar. It's different in size. Look at the difference in size of the bodies. The body for this one is larger. See how large it is? So at your waistline, if you take a small, let's say 50-cent piece, and you weigh 180, let's say you weigh 160 pounds, 80 pounds balances on this little area right here. And so above it and below it are fibrocartilaginous discs. And then there's a joint where these are facet joints. They'll glide on each other. And then transverse process and spinous process are where muscles attach, and the body is for articulations. So let's look at this old model. This is an old model. I've had it so long. There used to be fibrocartilaginous discs in there and they fell out. That's how long I've had it, okay? So there would be a disc here. This is a opening where the nerve comes out on the side. And so there should be flexibility here. And there is. And if you look in here, you can see the vertebral canal or the vertebral foramen that they want you to know. This is the spinous process proceeding away and transverse process coming out. One of the questions they sometimes ask, since we know there's 7, 12, and 5, what is the vertebra below the 5th lumbar? You have to know the name of the bone that's underneath the 5th lumbar.
Sacrum.
Sacrum. Mm-hmm. And the sacrum looks like a cornucopia, but its fused segments and it will give support to the pelvis. So if we look at this now from the back, it's a triangular bone, sacrum, and then what do we have down here on the bottom?
Coccyx.
Your coccyx.
Coccyx.
Okay, coccyx. C-O-C-C-Y-X, or tailbone. All right, while I have you here and while I'm holding this up, this is your pelvis. The pelvis is made, we're going to go over this part next week, but we might as well talk about it now. This is the ilium, iliac crest. This is your pubic symphysis with cartilage. Does anyone remember the type cartilage that is in the pubic symphysis? Same as in between the discs of the lumbar spine. What is it? Take a guess. Don't say elastin.
Hyaline.
Don't say hyaline.
It's fibrosa.
Fibrocartilage. Okay, so all the discs in the spine are fibrocartilage, and this is fibrocartilage too. Okay, is what we have. All right, this is the acetabulum. This is where the head of the femur goes in on the right side. So when I look at it, this is your right, this is the left. This is the sciatic notch. What goes through the sciatic notch? Anybody know?
Sciatic.
Sciatic nerve is going to go right through here. This is called the obturator foramen, and nerves go through there as well. And you are sitting, excuse me, on your ischial tuberosities. There's a roughened area here. So when you're sitting down right now, you're actually sitting on the ischial tuberosities. And on a male, the pelvis is very narrow. So this area in here, this region is very narrow. So most of us, all the men, we're sitting not so much on our ischial tuberosity as we are on our gluteus maximus. But most of you ladies are sitting on this bone. Why? Because your pelvis is wider. And with a wider pelvis, you're going to be on these. These are almost like rockers from a rocking chair. Okay, so let me make sure I've got everybody. All right. So anyway, this is a ischial tuberosity, and this is the ischium. So next week, we're going to be learning a whole lot of terms, more than what we're learning this week. Okay. Let's go over a flat bone. Does anyone remember what we have here?
Sternum.
From last week, the sternum. And what kind of cartilage is this here?
Hyaline.
Hyaline cartilage. And what were the three parts of the sternum? Manubrium. Body, and xiphoid process. You know XIPHOID, xiphoid process. So that's this. That's the bottom. Xiphoid process is a muscle attachment. The body is an articulation with the ribs, and basically the manubrium is an articulation with ribs, and there's a notch here where on either side, that's where the clavicle comes in. So this is a flat bone, is what we actually have. Okay, let's see if we've covered everything that we need to cover as far as for tonight's lab. I think we have, but let me go ahead and see if we have some questions thus far. It's got to be at least two. Nobody has any? That's not good. Nicole, you don't have a question for me? All right, how would I learn this? I would go and look at the various images. The images, for instance, will show you the inside of the skull, and they'll have an arrow pointing to the sella turcica and ask you what's there. It may have, you know, it'll mention the different features. It'll talk about the zygomaticus. It may talk about the different, there's actually a very good picture where we have, someone has cut the skull that you can look inside and see the frontal suture and the maxillary suture and the sphenoid and ethmoid, not suture, but sinus. So you can see the frontal sinus and the maxilla sinus and the sphenoid and ethmoid sinus. So you want to make sure that you look at all those images. The quizzes, I've set them at unlimited. So what does that say, Seth? If I set the quizzes at unlimited?
You do them until you know the stuff.
Take it until you know the stuff, but take it until you do what? Get 100? Try and get 100 on them is what you want to go ahead and do. And then that means you can repeat them. So it's just set for unlimited is what I have it set for right now. Okay? So what do I need to do if I were you? I would just make sure that I would go over and know these terms. You need to prepare yourself for I'm going to say in 4 weeks for us to take a test. It'll be multiple choice and it'll be true false. So, but you still need to know the terms. So I could ask, the features of the temporal bone, and you would need to be able to tell me that the mastoid process is there, or even that the external auditory meatus is there. And there may actually be a picture, but you need to know this. You need to know that in the occipital bone, that I have a foramen magnum and occipital condyle. Does everybody follow? When you nod, nodding is what occurs at occiput on C1. And when you move your head from side to side, that's rotation. So next week we actually we're getting off pretty easy. Next week we actually have like 5 pages of material that we need to go over. So there's quite a bit that we need to understand. So we'll be learning terms, and then we'll need to talk about movements of these various bones. So that's what we're going to do next week. So you got to get everything down. So study whatever you didn't study last week and whatever you need to study for this week, get it down so you have an understanding of what's there. And I'll be right with you. Can you still hear me okay? Okay. Obviously, what happened last night, this happened as well. But let me see if I can get back in. I can hear you, or at least I know you're there. Stay with me for just another minute. Let's see if we can get back in. Okay, we're here again. I don't know what happened. I don't recall touching anything, but this happened last night as well. All right, so what we need to do is just make sure you get a chance to study. If I were you, I would go through and just make sure you have an understanding of the terms that are there. Okay. Any other questions that we might have at this time for me? Okay, if not, what I'm going to do is end the meeting. If anybody wants to stay on online and ask me a question when others leave, that'll be fine. Otherwise, I'll see you next week, same time, same channel. Okay, good studying this week, and take care. Bye now.
Thank you. Have a good night.
You too. Do you have a good question for me?
In what page I can find the picture for Emma? I have this book.
Which one? Yeah, okay, so I do too. So it's the same one. Just go to the page on this skull.
Okay.
And on mine, it's chapter 8, and it shows all the different bones. Okay, do you see the bones?
Yes.
Okay, so that's where the majority of this. So what you need to do is look at the different pictures, look at the front, and then look inside, And then they'll show like the mandible, it'll show like the mandible and the different features. So you want to be able to identify those so you know what they are, okay? Same thing with this one here, okay? It's just basically the sternum, manubrium, body, and xiphoid process. So you need to know what they do as well as their name, okay?
Okay, thank you.
You're very
Have
welcome.
a good night.
You too. Thank you.